As Congress continues to look for ways to cut governmental inefficiency, many have set their eye on Medicaid. Grant Green has more from a couple public health officials on why they believe the billion-dollar cuts are not the solution to the problem.
A bill that will cut $715 billion from Medicaid and the Affordable Care Act is creating some concern. While Republicans say it's an effort to provide tax cuts, a couple of public health experts I spoke to say it's going to strip South Dakotans of some essential services.
Medicaid serves many purposes, as 1 in 10 people with Medicaid rely on it for their health care. It's often one of the quickest ways to access early cancer screening and can be the reason some small businesses are possible.
For a lot of small businesses that can't afford to buy into a private sector market, Medicaid is what a lot of them use for their employees to help get insurance. And South Dakota has a lot of small businesses in it.
Dr. Sandra Milstead, a longtime public health professional, says these cuts are not the best way to make healthcare more cost efficient and are only hurting the way many Americans receive treatment.
Rather than disinvestment in public health and such as Medicaid, there really needs to be a refocus by policymakers on prevention, systems change, and finding ways to focus on that prevention lens. We know that the U.S. spends more on healthcare than any other high-income country. And we have, unfortunately, some of the lowest life expectancy at birth and some of the higher rates of people with chronic diseases.
The GOP members have taken one step in that direction, as the House Energy and Commerce Committee opted not to lower the federal matching rate for expanded Medicaid. Some good news for South Dakota's 10,000 people enrolled.
The House floor vote for that bill is expected to come sometime next week, but has not been scheduled for a specific date. In Sioux Falls, Grant Green, Dakota News Now.